Now, hospitals across the UK are being told to prepare for the same COVID pressures that the NHS in London and the South East are currently facing.
Yeah, new daily cases have reached more than 50,000 for a fifth day in a row, as you probably know. The UK-wide total for people in hospital with the virus is now higher than at the peak of the first wave in the spring. Martin Berry from the College of Paramedics joins us this morning. Martin, good morning to you. What are your members, who are obviously the first responders very often, having to go out to people when they're unwell? What are they telling you about the situation on the ground?
Paramedics, as well as the rest of the NHS, are having to overcome some particularly overwhelming challenges. The significant increase in the number of individuals accessing the healthcare system, the pressures on services such as intensive care beds, which is backing up into the A&E, which means it then inevitably backs up to the ambulance service. And one of the main concerns that our members, and this is something that I've experienced working frontline over the Christmas period, is that increased amount of time waiting outside the A&E. Obviously, it has an impact on the care of that individual because they're waiting to receive the care that they need. That ambulance is no longer able to respond to other calls, and 999 calls are continuing to come in. People need that immediate assistance. But I was speaking to a colleague of mine only last night who was waiting outside an A&E for 5 hours with a COVID positive patient. And inevitably, that means that they are in a sealed, locked box with a COVID positive patient for 5 hours, which significantly increases their chance of contracting COVID-19 themselves. And that means that they're going to have to stay at home and be self-isolating.
Did they know that person had COVID? Had they been able to test them?
Yes, the patient was COVID positive. They had been tested. They were at home following all their advice, but unfortunately had deteriorated and therefore had to be conveyed into the A&E. But regardless, the department was full. There was nowhere for that patient to go, but the patient did need to be in a hospital unit. So again, this really adds to the...
Sorry, Martin, I didn't mean, sorry for interrupting. I just wondered if you could explain to people who maybe, many people will understand, but maybe not everyone will understand, why the ambulance has to sit there and wait when you arrive at the hospital, you know, with someone on board, why you're not able just to drop them off. Just explain.
It's very simply, that person needs to have somewhere to go. They've been taken to hospital because they do need care. They do need a place to receive that treatment in a bed, a cubicle, and receive staff observation to make sure that they are stable. We can't simply drop the patient off on the pavement outside the A&E and be on our merry way. That's not simply anything that we could possibly do. So we are having to be quite creative. But I think the real message that we need to be putting across here is it's really important that we get those paramedics as well as other healthcare professionals vaccinated as soon as possible. And unfortunately, ambulance services do tend to be missed. They do tend to be forgotten. They're outside of the core healthcare system in the minds of many of the strategic planners. So it's important that they do get the vaccinations.
Sorry to interrupt. I know I've got a friend who works as an ambulance, works in the call centre, and she's had her vaccination. So, I mean, she's not even necessarily therefore on the front line. But are you saying that ambulance crews are not getting vaccinated? Because surely they are on the list.
I think you raise a very interesting point. And while it's great for your friend who has been vaccinated in the call centre, they're not patient-facing. They're not dealing with COVID-positive patients. And often these vaccines arrive at, you know, not just hospital trusts, but ambulance trusts, and they start getting distributed amongst the administration staff. But it's a little bit challenging to vaccinate those that are out on the front line, so they often get delayed.
That seems crazy.
So it absolutely is. And what I would plea to all organisers and those that are organising the distribution of vaccines is let's vaccinate the people that are patient-facing first.
Isn't that an ambulance service issue?
While it's important that everyone does get vaccinated. But
isn't that an ambulance service issue, Martin, that they should, you know, realise they've got people coming in to do vaccinations at a certain time and they need to get the ambulance crews in first?
We have paramedic members that are also working in hospital trusts in A&E or in other departments of the hospitals, and they're reporting the same thing, that background administrative staff are often first in line to get these vaccinations, and the healthcare professionals are appearing further down the list. And that really is quite worrying. So, yeah, it is a problem and it does need to be addressed.
Martin, we're very grateful to you for your time this morning. Thank you for talking to us. Martin Berry, who's from the College of Paramedics.
Yeah, the complexities of rolling out this vaccine are incredible, aren't they? The hope is that within 12 weeks or so, everybody who's vulnerable, in fact, everybody who's over 55, will have been immunised. But as we know, it's not going as smoothly everywhere across the country.